Welcome viewers and listeners. I am Stacey Carmichael and today I'm joined by the Chief Executive Officer of the Georgetown Public Hospital Corporation, Brigadier retired George Lewis, as well as Director of Medical and Professional Services at the hospital, Dr. Fawcette Jeffrey. Now we'll be addressing some issues as it relates to the grievances of nurses and other frontline workers in the public health sector. Welcome, gentlemen. Now, CEO, there are a number of accusations that were leveled against the GPHC's administration by the union representing these workers. Could you bring some clarity to the issues?
First of all, I'd like to say thank you for having us. I'd like also to say thank you to all the hardworking staff members of the Georgetown Public Hospital for the wonderful work that they're doing at this time during the COVID-19 pandemic. The issue pertaining to requests for risk allowance, that is the crust of the issue. And I'd like to say that the Georgetown Public Hospital has, prior to COVID-19, been paying risk allowance to members of staff. The risk allowance then was primarily for those persons who worked in the infectious disease ward and in the psychiatric ward. Since the advent of COVID and our first patient in March, risk allowance has been paid to different categories of staff. Indeed, prior to our first case, around about 20 persons were getting risk allowance. Now we're paying risk allowance to 257 members of staff. The risk allowance are paid to those members of staff who are directly responsible for the care and treatment of COVID-19 patients. I wish also to state that no member of staff, and I'm really happy about this, has died from COVID-19. There was a supposition that a doctor and another medical person from the medical fraternity died, but I wish to state that that doctor was not a member of staff of the Georgetown Public Hospital, nor was the other person from the medical fraternity. The fact, again, I'm happy to state this, that we have not had any of our medical personnel dying. It's a testament to the activities that the hospital administration has put in place. We've instituted a number of measures. Later on, I'll ask Dr. Jeffrey to touch on some of them. But the one that I really would like to speak about is the procurement and issuing of appropriate personal protection equipment for staff members. That's one of our major focus. We hope that members of staff can perform their duties in an efficient manner, in a safe environment. And that is why the administration has paid lots of attention to the procurement of appropriate PPEs. So basically, I'm saying that we have been and we continue to pay members of staff risk allowance, and we also ensure that we provide adequate equipment in the form of PPEs for them to perform their duties.
Thank you very much, CEO. Now, Dr. Jeffrey, as the Director of Medical and Professional Services at the Georgetown Public Hospital, what are some of the systems that were put in place prior to COVID-19 to assist in, the well-being of the staff, as well as those systems that were put in place from the onset of the pandemic?
Okay, thanks for having me, and it's a pleasure to be here to explain all the things that we have done at the Georgetown Hospital. And we're happy to have had a response from the time there was the announcement of COVID-19 being discovered sometime late in December, and then when it was declared a pandemic. From that time, the Georgetown Hospital started making moves and putting things in place to be able to, in the eventuality that we would have the first case or cases in Vienna, at least we would be ready for those cases. So we started training. And training meaning how do our staff members are not only nurses and doctors, but all the staff, attendants, drivers, laboratory technicians, all across the board. We started training them with understanding what is infection prevention control, how do they use PPEs, how do you use a mask, how do you don and how do you doff a hazmat suit. And these trainings started locally at the Georgetown Hospital, and I would even say that our Georgetown Hospital staff extended their hands out to the regional institutions, and we sent staff from the Georgetown Hospital to train persons in the regional institutions to be able to become prepared for COVID. Apart from that, we had to make structural changes at the Georgetown Hospital because we know that COVID-19 tended to manifest itself with very severe respiratory difficulty and manifestations. So with the permission of CEO, we were able to identify a zone in the hospital which we created as our infectious intensive care unit, which is now the only infectious intensive care unit in the country. And we're the ones who are housing all of those patients who need to be intubated or have CPAP or some form of intensive care because of COVID. I can say to you it was not easy, it was a challenge to get to the point of readiness. And I remember the struggle when we were told that the very first case was being referred to us to be housed in the intensive care unit. But we managed to pull it off. Then around the institution, understanding the ethiopathology and the physiopathology associated with COVID-19, we also put measures in place around the institution so that we can protect both our staff members as well as the patients coming. So in every entrance of the institution, we set up screening points. Initially, there were screening points that were done under tents. They were done in locations that were convenient at the time with the infrastructure that we had. And as the months went on, we constructed permanent structures to make not only screening, but triaging possible. So we have like a triage center in the street. A patient who comes to the hospital who has symptoms of COVID is not allowed in the institution. The patient is triaged and, if necessary, even swabbed in the center that was developed in the street. We also have a triage center in Middle Street where when you're going to the medical outpatient department, you're screened, and if you need to be triaged, you're triaged there. So we have done these different, put these mechanisms in place so that we can protect our staff from persons coming in, as well as protect them from themselves. Because if a staff comes in and has symptoms, we stop that staff from getting into the institution because that's a possibility of transmission. So every gate in the institution, and that will include Lamaha, East Street, Newmarket North, Newmarket South, and Middle Street, we have screening points. We have persons with thermometers, persons with hand sanitizers. We've put sinks for washing hands. So all of these mechanisms were put in place. But the part that I think was most important, apart from putting these mechanisms in place, was the education. And for education of our staff, it was not only just, okay, we take you to a classroom or we take you to some place and we give you a lecture. We formulated what was called the Georgetown Hospital COVID Task Force. Now, the COVID Task Force was formulated, and most of the persons, heads of departments, especially of internal medicine, intensive care, pediatrics, general surgery, So we had a task force that comprised of almost 22 persons. And we would make additions to the task force or subtractions to the task force depending on what we were going to debate in the meeting. Now, the task force wrote protocols on every aspect of the prophylactic management of COVID and the management of COVID from the inception. What do you do when someone comes to the hospital? How do you use your PPEs? To last offices, meaning if you die, how do we manage you? And our protocols at the Georgetown Hospital, thanks to my staff who are so cooperative and helpful, has now been some of the protocols that we were able to share with the rest of the country, all the other institutions, so that they could be guided as to how they can be prepared for patients who may present with COVID-19. Now, the use of PPEs is vital. And I'm not going to say that PPEs have not been difficult sometimes to acquire, because when you look at the international news, you realize that it's not unique to Guyana that sometimes it's hard to get PPEs. But we will never say that the Georgetown Hospital has been without PPEs completely at any time. We have always had PPEs through the procurement department and the help of the CEO. We were able to get masks. Sometimes we may have a shortage of the mask, so you have to make a decision as to how you use the mask. So the protocols help you to decide how to use a mask in what circumstances. Initially, when we started, we used to use a hazmat suit for every patient that we see. Then as we learned more about COVID-19, we realized that it was not necessary to use a hazmat suit except you're going to do an aerosolizing procedure. So our protocols changed and had to be amended from time to time. But I am really surprised that we are being questioned about how we prepared ourselves and how we educated our staff and the mechanisms we put in place to assist our staff to manage COVID-19. I'm really surprised.
Thank you very much, Dr. Jeffrey. Now, CEO, this question is for you. The union also mentioned a few other things. Was notice given by the union as it relates to the protocols? Because there's a threat of strike action next week, sometime next week. I think it's Wednesday, October 7th.
We did receive a notice recently from the union pertaining to possible strike action. But when we received the notice, that was long after there were protest action taking place outside of the hospital and around the hospital. And we felt that the process was incorrect. The process was against the law, and the process also did not follow the sequence of action that is supposed to take place before you take protest action or you take strike action. In fact, we at the Georgetown Hospital would have, in April this year, had lengthy discussions with members of the doctors and the nurses branches of the Guyana Public Service Union. And coming out of those discussions, a number of agreements were made. And some of the agreements saw the hospital working in conjunction with the Ministry of Education, and now in conjunction with the Guyana Defense Force, providing free transportation for members of staff to move to and from work. It also saw us providing risk allowance, which I mentioned to you before. And as I'm touching on risk allowance here again, I must say that the payment of risk allowance is based on circular number 2019 of 2019, which outlines which categories of workers are meant to receive the risk allowance. And I think that's one of the issues that we have at this time, because the Public Service Union is claiming that all healthcare workers, all categories of healthcare workers should receive risk allowance. However, we have no authority to pay risk allowances to those persons because the circular to which I referred before does not facilitate or permit you to do that. We also have been providing meals to all of those workers who work in the COVID intensive care unit, which Dr. Jeffrey alluded to. We provide free housing at the staff quarters in Carmichael Street and Waterloo Street for those workers who are working in the COVID intensive care unit. In that way, after finished work, they don't have to go home to their families and the possibility of contaminating their families or so on. They're in an isolated area where, and we're providing accommodation for them and feeding free of cost. Here, I also would like to mention, and I want to thank private sector organizations and some other non-governmental organizations, because since the onset of COVID, we have received lots of donations. Some donations come in the form of food, beverages, PPEs, and so on, which go towards the frontline employees who are involved in the COVID-19 fight. So there are monetary and non-monetary benefits that employees of the Georgetown Hospital are receiving at this time.
Okay, CEO. And what would you say to those nurses and other medical workers in the field at this time?
I would say that the administration is committed to working along with the union to improve the lot of our workers. Some of the initiatives I spoke to you about before were implemented by the administration before any intervention was made by the union. And we will continue to work to improve the lot of our workers. And I'm not speaking here about nurses alone, because our employees span doctors, nurses, lab technicians, and so on. And we have a commitment to continue to work to improve the facilities that they have, and at the same time improve the conditions of work. I would say that staff members should support the administration at this time, and at the same time give the administration time to work on these issues and to conclude its discussions with the Guyana Public Service Union. I'd also want to say to the union that I think it's premature to prompt or encourage workers to be involved in protest action and in strikes without us having exhausted all the avenues for the settlement of grievances. I would also want to say thank you to all those workers for the contributions that they've made in terms of the fight against COVID, and also those who do not work directly with COVID patients, because the hospital still continues to function and provide care for other sick people. And I'd like to say thank you to all of them. We're grateful, and we would continue to work to ensure that we can improve the environment and the equipment that we provide and their lot generally.
Thank you very much. Now, Minister of Health, the Honorable Dr. Frank Anthony, has also joined the discussion relating to the grievances of the nurses and other frontline workers. Now, Minister Anthony, what would you say to those nurses, other workers in the medical field at this time, given the COVID-19 pandemic and them threatening strike action and sitting in as far as we know now?
Well, thank you very much for having me on the program. First of all, what I would like to say, I want to express gratitude to all those nurses and frontline workers who have been working to save lives and save people from since March, and even before that, because this is a profession where we work with people and help people. And I'm extremely grateful that they have continued to do this. From time to time, there might be challenges, but they have worked and make sure that their patients are safe. So I'm extremely grateful for that. As I understand it, the union or some nurses at the Georgetown Hospital, and we've seen this in some of the other hospitals as well, they have been making certain claims that, for example, they're not getting PPEs, and because of that, their lives are in danger. We would not, at the hospital or any one of our institutions, want to put any nurse or any healthcare worker in jeopardy. That's not what we're here for. And we have made a concerted effort to acquire PPEs, masks, gloves, you name it, we have been working to acquire it. And we do have supplies to supply to our frontline workers, because we recognize that if they get sick, then they can't deliver care. And we don't want that to happen. So that is why we have made that effort to ensuring that our workers receive the kinds of protective gear that is necessary for them to do their work. And we will continue to do so. We understand that the union have written and they have pointed out certain things in their letter. We want to refute some of it because we don't think that it directly concerns the GPHC. In the letter, by inference, they were suggesting that you had a doctor and another healthcare worker that died. But none of those deaths are really directly related to the GPHC. They weren't staff of the GPHC, and therefore to infer that these persons would have passed away because of their service at the GPHC, I think it's very unfortunate. So we have really worked to make sure that our staff remain safe, and therefore we want to reject those inferences. We also understand that they were suggesting that we weren't providing PPEs to our staff, or that our staff would have to reuse PPEs and things like that. Again, from the information that I have, I don't think that is true. Nevertheless, whatever the grievances are, the staff of the GPHC, the CEO and his technical team have not refused to meet with anyone, and from what I've been told, they have been actively engaged in meeting with the GPSU over a protracted course of time, and more so that they have also formed various committees where they have been discussing different matters. We think that is a good process, and that should continue, and we would want to facilitate that. And as you have heard, we have been constantly making improvements to ensure the safety of our staff, and we want to continue to do that. So those persons who have come out and have been working with us and working to improve the system, working to ensure that our patients, when they come, they can get the service that they deserve, we want to say a big thank you. And for those persons who have taken some protest action, we want them to seriously consider what they have embarked upon and whether or not they feel that that is the right course of action. Because I think if in their quieter moments they're able to examine their actions, then they might they might recognize that there's a level of irresponsibility in what they have done. So we want to appeal to them, and I'm sure with all healthcare workers, your first instinct is to work and to serve people. And I'm sure that us appealing to them to come back out and to work and to continue the good service that they've been giving to people, while whatever the issues are, we work with the union to resolve them. And we are willing to work with them directly too to resolve whatever issues they have. But they have to make known those issues to the administration so that we can solve them. We can't solve something in abstract. We can't fix a problem if we don't know what the problem is. And therefore, our appeal is come back to work, those that have been protesting, and let us resolve the issues, because I don't think the problems that, or at least some of the things that we are hearing, that they are insurmountable. We can fix them. So I just want to appeal to them, and across the country, if there are nurses who have been, misguided, because I notice in the social media and other forum that there are lots of misguided information. We will appeal to them, talk to the legitimate administrators, talk to the people who are in the know, rather than getting second-hand, third-hand, fourth-hand information that is not necessarily correct. So talk to the persons who are directly in charge of these facilities so that they can offer you proper advice and proper guidance. So again, we really value the work that our healthcare workers have done, especially during this pandemic. They have done a remarkable job. And we want to commend them for doing that job, and we want them to continue doing it because they have made a big difference. When we talk about the amount of cases that we have, people think about the rising cases, but those numbers, I don't know how many people have really stopped to think about how many people have actually recovered. And we have many more who have recovered and gone back, and they're, gone back to their work, and they're quite healthy than those who are currently infected. And that's because of our healthcare team right across this country. They are the ones who have been providing guidance, who have been working with people to ensure that they move from being sick to being healthy again. And so we have a key role to play, all our healthcare workers, and we want them to play that role, because at this point, during this pandemic, they're the key and pivotal people that we have to listen to and to make sure that services work. If we don't have these services working, then we'll be putting a lot of people in harm's way. And I don't think that is the oath that any medical worker has taken. Our first oath is to serve people and to make sure that, they can benefit from what we have to offer. So I just want to make that appeal. And I know that it would resonate with our nurses and other categories of workers, because at heart they are really true humanitarian. And I think that they would want to come out, especially in this time of need, to ensure that the rest of our population remains safe.
Well, thank you very much, Dr. Anthony, and also thank you very much, Mr. Lewis, for being a part of the program. Thank you also to the viewers and listeners. This has been a special program where we discussed the grievances of the nurses and other frontline workers in the health sector. Thank you.